I haven't cried these past years. There are no more tears. But when I walked into the empty hospital, I just couldn't help it. A private hospital in Hebei, which had invested 200 million yuan, has closed. As the person in charge, she returned to an empty hospital. She choked up several times, almost crying. The hospital once had an annual revenue of 60 million yuan, but it all collapsed overnight. The Tianyou Children's Hospital in Xi'an, Shanxi, has also closed. A video shows that in April of this year, the hospital was already empty. Not only were there no patients, but even the medical staff were gone, leaving only the gatekeeper. The Liupanshui Hospital in Guizhou also shut down. A nurse filmed the corners of the hospital where she used to work, including the operating room and the on-call room. The video shows the hospital issuing a closure notice, stating that due to ongoing poor financial performance and consecutive years of losses, the hospital had decided to cease operations starting September 1st, 2025. This year, China's healthcare industry is experiencing an unprecedented structural earthquake. The wave of hospital closures sweeping across the country is intensifying. Private hospitals are the hardest hit, and even public hospitals are starting to show warning signs. The closure wave began in 2025, and entering this year, the trend is not slowing down, but rather accelerating. According to a Sina Finance article, as of June 2025, 1,247 private hospitals have closed, an increase of 163% compared to the same time in 2023. Among them, 37 were Level 3 hospitals, 289 were Level 2 hospitals, and 921 were Level 1 or unclassified hospitals. Since 2020, over 2,000 private hospitals have closed or gone bankrupt.
I never imagined that hospitals could actually go bankrupt. You see, Maria Hospital, once the top obstetrics and gynecological hospital in Changsha, had been operating for 15 years, and now it's closed. In fact, it's not just in Changsha. I heard that many Maria hospitals across the country have already closed.
The main reason for the closure of Maria Hospital in Changsha was interrupted financing, which led to an inability to pay salaries and debts, ultimately forcing the hospital to shut down. This wave of closures has already caught the attention of the recycling industry.
I'm being honest here, I'm a scrap collector, and now you've turned me into a professional at collecting bankrupt hospitals. In 2025, I've already dealt with the closure of over 50 hospitals.
Since 2025, the number of private hospitals closing or going bankrupt has expanded from third and fourth tier cities to first tier cities. The list continues to grow. In Xi'an, a 7-star obstetrics and gynecology hospital, which cost 1.1 billion yuan to build, has entered bankruptcy reorganization. The court-appointed bankruptcy administrator is publicly recruiting investors to restructure the hospital. At the same time, in Suzhou, Jiangsu, the medical equipment of Jici Hospital is being auctioned, and the fully owned subsidiary of Peking University Pharmaceuticals, Peking University Medicine, is facing closure due to the termination of long-term service contracts. On September 26, the Suzhou Health Commission in Jiangsu released a notice announcing the closure of Peixian Jianhua Hospital. The notice states that the hospital has applied for closure, which will last 4 months between September and the end of the year. According to reports, this hospital was originally known as Haozhai Health Center. It was restructured into a private institution in 2006. It is now a non-profit, second-tier comprehensive hospital known as Suzhou Third People's Hospital Peixian Branch. In 2018, the hospital covered 50 acres with a building area of 30,000 square meters. That year, it had 180 outpatient visits, 12,000 inpatient visits, and generated 100 million yuan in revenue. In November 2021, Jiahua Hospital moved its location next door. It had a building area of 74,000 square meters, 29 departments, and 12 wards with 600 beds. 2 months later, the hospital announced the launch of the second phase of its medical and elderly care integration project, which planned to build a senior apartment complex comprising 90,000 square meters and 780 beds. Behind the hospital's expansion, a crisis gradually emerged. Despite having nearly 70 years of history and undergoing multiple restructures, the second-tier hospital could not escape the fate of closure. According to company registration data, the hospital is currently involved in multiple disputes, with total enforcement amounts reaching nearly 13 million yuan. In addition to the Xuzhou Hospital, the largest private three-tier hospital in eastern Guangdong, Shantou Guorui Hospital, was once highly anticipated, with billions of yuan invested and ambitious plans, but it became a half-built project due to broken financing. Chengdu Mingsheng Gospel ENT Hospital, after only a few years of operation, officially filed bankruptcy in June. Liaocheng Southwest Hospital, a third-tier private one, also declared bankruptcy. Beijing Mai Rui Orthopedic Hospital, a high-end specialty hospital, also couldn't escape. In February this year, Ruichang 621 Hospital in Jiangxi posted an announcement about stopping its operations. The announcement stated that due to serious losses, the hospital would cease operations starting the end of February, with a unanimous approval from all shareholders and the relevant authorities. A healthcare worker stated that the hospital had over 60 employees, all of whom hoped for it to reopen. She, as a long-term employee, felt deeply attached to the hospital and found its closure hard to accept. Another staff member also stated that the hospital had officially ceased operations on the 27th due to financial losses. Some members voluntarily left, others found new jobs, and patients have been transferred to other hospitals. The hospital was quite well known and even had patients coming in from other provinces for treatment. A staff member from the Ruichang City Health Commission responded, saying they're quite aware of the situation. The hospital, a private institution that had been operating for quite some time, has now ceased operations because there were no patients. The hospital was established in 1970 and was a second-tier comprehensive hospital offering medical care, preventive care, rehabilitation, emergency, elderly care, and community services. It also served as a designated hospital for urban and rural residents' medical insurance and workers' social insurance. In March 2018, they opened a new nursing home. In January this year, a star hospital in China's large cancer care sector, Chongqing's first tertiary specialty hospital in Wanzhou district, filed for bankruptcy. It was once regarded as an industry model. The hospital was backed by private capital, state-owned enterprises, and local governments. It had a total investment of 3 billion yuan and 1,700 beds. In terms of hardware, the hospital spared no expense, investing 600 million yuan to introduce first-class proton cancer treatment equipment, along with a dedicated proton center. The 4-story building alone cost 420 million yuan, and the entire setup was valued at over 1 billion yuan. However, after just 2.5 years, the hospital found itself in a dire situation. Now, the equipment is gathering dust, and over 90% of its 1,700 beds remain unoccupied. In fact, in 2024, news of hospital bankruptcies emerged from various parts of China, mainly involving small and medium-sized private hospitals, but also a few public ones. Some notable cases include the bankruptcy auction of Suqian Children's Hospital, which had over 400 million yuan in debt, and a public hospital in Meizhou, Guangzhou, which filed for bankruptcy due to unpaid wages. Last year in Suqian, Jiangsu Province, the Huiren Hospital posted a legal notice on its doors, marking the process of its financial collapse. The private hospital was warned due to unpaid wages. This private hospital was on notice due to unpaid wages, and 4 months later, it had still not fulfilled its obligations. At the end of last year, a public hospital in Meizhou, Guangdong, Jiayin College-affiliated hospital, temporarily suspended its services. The primary reason was that after the medical staff had not received their salaries for 10 months, they were asked to resign, and the hospital soon entered the asset liquidation process. To be rated as the highest-tier hospital, this institution invested 120 million yuan in 2021 to build new buildings and purchase equipment. However, during and after the COVID-19 pandemic, the hospital's revenue drastically dropped. By 2023, its business was only half of what it was previously, leading to financial difficulties. Another example is the Jingdun Hospital in Chenzhou, Hunan. It was unable to settle maturing debts and was declared bankrupt by the court on November 15, 2024. 2 days earlier, the Nantong Zhonghai Hospital was ordered into forced liquidation. So, why are hospitals collapsing en masse? An article from Internet World analyzes several factors behind the crisis. 1. Capital withdrawal. Many hospitals expanded with the help of capital inflows, and once financing stopped, they quickly fell into crisis. 2. Trust crisis. Some private hospitals overmarketed their services while delivering inconsistent quality, causing patients to vote with their feet. However, these are only part of the reasons, and the true cause of this widespread hospital closure goes far beyond that. Washington-based economist Li Hengqing points out 4 main factors. In addition to the public's mistrust of the healthcare system, the real estate expansion in recent years led to overdevelopment of hospitals. Additionally, two other key factors are the bankruptcy of medical insurance and the changes in the population structure. The number of people paying into the medical insurance has been declining for 4 consecutive years. Professor Liu Junqiang from Tsinghua University estimates that the medical insurance fund may be exhausted within the next 10 years. Another criticism of China's medical insurance system is the clear inequality in healthcare. The majority of the insurance funds are allocated to CCP elites, while as many as 200 million flexible workers in China's gig economy lack proper medical insurance or have very low coverage. Many farmers in China are planning to abandon their medical insurance. In a time of economic downturn and declining incomes, the renewal fees for small farmers have become a significant burden. Some villagers even say it's foolish to pay the fees. Regarding the population structure, a report from the 21st Century Economic Herald quoted Liu Jian, a member of the Medical Equipment Development Promotion Committee of the China Pharmaceutical Education Association. Liu said that hospital closures are primarily caused by population movement. The hospitals that have shut down are mostly located in cities with severe population outflow, or third and fourth tier cities. As large numbers of people move to more economically developed areas, towns experience population hollowing, naturally reducing medical demand. Professor Chunhui Chi from Oregon State University's College of Health explains the COVID-19 pandemic has led to severe financial problems for hospitals. With local governments lacking funds and reducing medical insurance payouts, hospital bankruptcies have worsened. Of course, there are other reasons for the widespread hospital closures. A Sina Finance article states that the National Medical Insurance Administration's crackdown on fraudulent claims has cut off the survival path for some private hospitals. In the past, many private hospitals operated irregularly, relying on fraudulent hospital admissions, fake surgeries, and fake medication to siphon off medical insurance funds and maintain daily operations. This year, the National Medical Insurance Administration revealed numerous fraudulent claims in Sichuan, Chongqing, Shanxi, and other regions, most of which occurred in private hospitals. A major shakeup in the healthcare market is underway. Whether public or private, the era of easy money is over. The wild growth period for private hospitals has ended, and 13 million healthcare workers are caught in the crosshairs. They are not the decision makers, but they're bearing the costs. Layoffs and salary cuts, hospitals closing and contracts becoming void, wages delayed for months, promotions reset, losing seniority by starting over at new institutions. There are also role changes, with clinicians becoming administrators or customer service staff, or even forced to change professions. With this psychological distress, these angels in white now struggle for basic benefits like Social Security and insurance. A chief physician from a top-tier hospital said, "I studied medicine for 8 years and worked night shifts for 10, and now I have to reconsider whether delivering takeout is a more stable option." What's even more heartbreaking is that many doctors, after hospitals close down, can't even get basic compensation. In some hospital bankruptcies, the salaries of medical staff are paid last in the asset liquidation process. Some hospitals are closing, while others can't even pay salaries and are on the verge of shutting down. Earlier, we mentioned the closure of Maria Hospital in Changsha. In Chengdu, Maria Tianfu Hospital and Children's Hospital has also faced salary delays and employee protests. In February, Chinese media reported that the hospital had delayed salaries, leading to a strike. Pregnant women and their families surrounded the hospital. A woman claiming to be one of the investors in Chengdu Maria Tianfu Hospital revealed that due to salary issues, 8 doctors in the obstetrics department had abandoned their posts, causing the department to stagnate. Recently, a public account posted an article in which a medical worker complained that starting in May, their hospital had stopped issuing night shift pay and performance bonuses. The article described how, on a rare day off, she invited a close friend out for a meal, but her friend hesitated and eventually explained that her workplace hadn't paid performance bonuses for 5 months and she was struggling to get by. For nurses who rely on their salaries to survive, the 4-month delay was a heavy blow, with family expenses, mortgage and car loans, and children's education costs piling up. Every expense weighed on her shoulders. Her small savings were barely enough to cover basic living costs, and she couldn't afford any entertainment. Now even eating out became a luxury. A netizen said that the problems in hospital operations are due to various factors. One major reason for the hospital's operational decline is that medical insurance payments were delayed, reduced, or deducted by the insurance departments. Hospitals don't make any money for medications, yet they still have to pay all the expenses for the pharmacy department. Insurance checks and fines are not small either, which all makes it harder for hospitals to survive. How can people's health care and health protection be guaranteed? Another netizen shared that they were shocked when a doctor friend mentioned salary delays a couple years ago, especially in a top-tier hospital where the place was packed with people. Yet they were still struggling like a private enterprise with delayed salaries. A third netizen said, "The more you work, the less you get. Meanwhile, people with connections in low-risk positions get higher wages. It really chills the heart." Another netizen commented, "It seems that the overall environment is bad. Hospital business has also shrunk by 2/3. In addition to hospitals, in 2025, China's retail pharmacy industry is facing an unprecedented crisis. In 2024, around 40,000 pharmacies across the country closed, averaging 107 closures per day. Entering 2025, this trend has accelerated. In the first quarter, over 3,000 pharmacies closed, and in the second quarter, another 4,000. The total number of pharmacies decreased from 660,000 to 653,000, with an estimated 100,000 closures for the year. This means 274 pharmacies are closing every day on average. Pharmacies were once regarded as a sure thing with guaranteed profits. Now they've become one of the hardest hit sectors in the economic downturn. Commentator Xiao Yi stated that pharmacies have gone from being a universal necessity to an economic disaster zone. Medical insurance cost control, consumption shrinkage, aging population issues, and online competition have all deprived pharmacies of their survival space. The closure wave is not just an industry shakeup, it's a sign of a sharp decline in consumption and deflationary pressure on people's livelihoods. However, the closures in physical pharmacies is not an isolated crisis, but rather a concentrated eruption of structural contradictions. Over the next 3 years, the pharmacy industry will face brutal restructuring, with more than half of pharmacies expected to exit the market. But the bigger problem is that the issues with consumer purchasing power and the gaps in medical insurance have not been addressed. Without institutional reform, the upcoming industry restructuring and economic adjustment will be even more painful. In fact, the reshuffling of the pharmacy and hospital sectors serves as a barometer for social welfare. It indicates that China's economy is shifting from high growth to high risk. Weak consumption, strained finances, an aging population, and the bursting of industry bubbles. Going forward, the entire healthcare industry will face an uncertain future.